Hello and welcome to our Facebook Live Q&A on living with endometriosis. I am Rami Kaldas of the Kaldas Center, and joining me this evening, making it a very special evening, is our wonderful panel made up of women with first-hand experience living with endometriosis. I know we're here to talk about endometriosis, but we would be remiss if we didn't address the latest news on COVID-19. At the Kaldas Center, our top priority is always the well-being of our patients, and we are taking every cautionary measure to make sure we all stay well. We are wiping our place down constantly, and we are big-time germaphobes at the Kaldas Center in your best interest. Please visit the CDC's website for up-to-date information on COVID-19 and refer to your local public health department for further resources. Remember, the best way to prevent the spread of the virus is to wash your hands with soap and water, cover your coughs and sneezes, and stay home if you are sick, and avoid touching your face. And our thoughts and prayers are with those who have been affected by the virus or may be in the future. And with that said, please welcome our panel, Sonali and Andrea. We're so happy to have you here with us tonight. We'll be doing our part to raise awareness, as March is Endometriosis Awareness Month, by talking openly and honestly about the impact of endometriosis. Before we begin, a reminder that this discussion is meant for informational purposes only. If you have a serious health concern, please consult your physician. If you would like to contact us at the Kaldas Center, please visit kaldascenter.com or call 920-886-2299. And remember, no referral is needed to visit the Kaldas Center. You are not alone in your discovery of your own body and endometriosis, and if you have it or not, and you should not feel isolated, you should come and talk. We'll start by getting to know our panel, and at the end of the evening, we'll be taking your questions on everything from difficulty in diagnosing endometriosis and managing it and excising it. We encourage you to post your questions in the treatment section, in the comment section of Facebook Live, or if you would like to submit an anonymous question, since we want everybody to feel comfortable, please reach out using Facebook Messenger and indicate that you'd like to share your question anonymously. We most welcome that. So, Sonali and Andrea, thank you so much for joining us tonight and sharing your experiences with endometriosis. These are harrowing stories you've got, and they are, in fact, rather indicative and representative of what we see at the Kaldas Center on a regular basis. Can you tell us where each of you are from and how your endometriosis journey began with the Kaldas Center?
Well, I'm from Georgia to begin with, and well, my endometriosis journey begins almost 20 years back when I was a teenager, somewhere in my 19 years. The pain started out of nowhere, and somewhere down the line I knew that this was not a normal period pain. But every time I go to a gynecologist or I ask someone from my family or friend or neighbor, they would say it's just a usual normal pain that happens to everyone. And the bleeding was also unusual. And I would think that I'm the only weak one here who would just curl up in the bed or in the couch for the 4 days that I would get my periods. But every other person could do everything normally. Well, it affected my career, it affected my college, it affected my work, my married life, and everything that was possible, my family life even. But for 20 years I was trying to find out a doctor or a person who could tell me what is wrong with my condition. I was also detected with PCOS, because every time I used to go for ultrasound, they would tell me either it is PCOS or maybe it is a hormonal imbalance going on with you. Really? But when you get the hormone profile done, everything is normal. And then after my birth of my daughter, that was a cesarean section, I bled almost for a year during my
Oh my goodness.
breastfeeding time, and that was the time, another harrowing time, where I went to several gynecologists, and none of them could detect any condition, except for they said that it's a hormonal imbalance. And I was suffering with bleeding, I was suffering with my stitches of the cesarean section, and my child was small, my periods were very heavy, and the pain continued. And lastly, in 2019, that was last year, when I was having severe pain and bleeding, the ultrasound results came out with PCOS and huge masses on both the sides of my ovaries. And they suspected it's a possible cancer.
Oh my.
And then when I went, within 2 weeks of that, they suggested me for surgery. And it was almost 3 hours of surgery. When I came out of it, just to learn that my ovarian cysts and masses have been removed, but I have 4th stage 4 endometriosis, and they couldn't do anything about it.
My goodness, what kind of surgeon operated on you?
She was a cancer surgeon.
A cancer surgeon. Oh my goodness. Okay.
And
so at that moment you felt like there's no hope.
Yes.
When this is supposed to be the best of the best surgeons. And,
yes.
But that's
it. That's it. I mean, when I came out of the surgery and I got to know that it's stage 4 endometriosis, I didn't have a minimum idea of what it is like. What is endometriosis? Right. That was the first time I heard the term endometriosis, and I start Googling it, and then I know there's no cure for it. There's no medication. And I thought, so this is it. I have to stay with it for the rest of my life, and I have to suffer this terrible pain and bleeding forever.
What did that do to you psychologically, Sally?
Well, psychologically, I was devastated. I went into a very dark place where almost like I wanted to end my life. I didn't want to live anymore because I was in constant pain and bleeding. And for my family, for them to see me in that condition each and every day was another painful fact of their lives. So it was not only me who was destroyed, it was a whole family, my parents, my daughter, my husband. Everybody was losing their mind.
Well,
it was affecting the whole family as I don't know what to do.
Sure.
So we started researching on someone who's specialized on endometriosis. And then after a month or so, my husband came up with the Kaldas Center. And he told me that I've got a specialist who's more specialized into endometriosis, and let's go and check if he can help us. So that's how I came to know about Kaldas Center, and I didn't have much hope, but I just gave it a try. So when I arrived and I spoke to you and the whole condition, you just gave me a lot of hope, and it felt like that you know a lot of details of endometriosis and my condition exactly. Well, the doctors there back in Georgia, they had said that I need a colostomy. But I didn't know what a colostomy is. I didn't know any details about it. They just said that your endometriosis is so bad that it has completely changed the structure of your colon. And I didn't know what that means. I was like, you need a much bigger surgery after this if you want a real treatment for it. And I was like, I'm not ready for any more surgeries. This was enough because I was cut in half almost.
Oh my.
So after meeting you and when I told you that I need a colon specialist, you remember that?
I remember very well.
Yeah, I need a colon specialist because I need a colostomy or something. You said, no, you don't. I can do it for you. And I was scared because I had so many stitches all around and I was like, what do I do? Again, a surgery? And you said, no, I'll just make 3 little incisions and you'll be done. I was like, that's unbelievable. I really couldn't believe what he was saying at that point of time. I said, really? No, it can't be true. Because my past experiences were really bad.
Well, thank goodness you persevered, and you are very courageous and for sharing, because there are so many out there hearing and listening and watching tonight that have very similar stories. And Andrea, please share your long history with endometriosis.
Well, I had a similar path in going a very long time and trying to figure out what was going wrong with me. I didn't have the same level of surgical intervention. My mishaps were in the form of blank stares from doctors that they may ask me a question or two, but it yielded really no response and no answer and no medical care. I was trying to think back to when I first knew that something was really wrong, and I'd say probably 13, 14. My mom took me to a gynecologist. They talked through it. They said, oh, she's just got hormone issues. She's just a hormonal young lady.
The hormones again. Oh my goodness.
And I, just had to deal. And when I would try to tell doctors, when I would try to tell friends, that I'm experiencing this pain, I think part of it is, as women, we don't really have the vocabulary to talk about it. We have that word cramps, and we could say that our period is heavy, but we don't really, it's not socially acceptable to really talk about it in a level of detail that could help people really understand the level of pain you're in. Before we started talking on Facebook, you were saying that it felt like you were shot with a bullet in your abdomen, and that's the kind of feeling you have. And I went into my 20s, I had cystic acne, heavy periods, really horrific cramps, and I was put on the birth control pill, and that really did help the cramping and the heavy periods. And I think it masked those 2 major symptoms that maybe a doctor would have picked up that it had been endometriosis. I was on the pill for a long time, but I still had really significant other symptoms. I had painful intercourse, and I was told, by a doctor, maybe you just need to calm down. Maybe you need to just loosen up. I would blow up in a puzzle. I don't think so. That doesn't feel quite right. And that was probably the most conversation I had gotten out of a doctor.
Oh my goodness. And
it got to a point that I really thought I was afraid to go to sleep because I thought I might hemorrhage to death.
Oh my goodness.
And I had said so many things to so many doctors and was hesitant to go. And actually, for my job, I'm an elder lawyer, and I had a senior client who had a different health problem. It was an issue with her lungs, and she'd been shuffled around from doctor to doctor. And I said, she was a lovely lady, and I told her, I'm like, take off all your makeup. If you're embarrassed, put a hat on, put sunglasses on, go to the doctor, let them see how you really are. She ended up getting a very significant diagnosis, and I thought, if I can give her that advice, I need to take that advice myself. And was going to a chiropractor thinking that might help with some of the cramps and some of my other physical issues. And I kept seeing the cover of a magazine to the side. Sometimes 3 times a week I would see this magazine and it had your face on the cover. And I thought, okay, this is a sign from the universe. I'm going to follow my own advice. I'm going to go to the doctor one more time and I'm going to really talk about this. And you were the first doctor in my 43 years of life, ever since I had started having a period at the age of 13. That when I talked, you didn't give me a blank stare, you didn't stare away uncomfortably, but you leaned in. And you really legitimately, literally leaned in and listened to every word and made eye contact with me like you're doing now. And that, I think, is the key, was being able to really communicate with somebody, be comfortable talking about embarrassing situations, and moving forward. And I ended up having the laparoscopic procedure. I posted a picture on Facebook in front of your office and got hundreds of comments. It was just it was a really windy day. The wind was blowing. It took me a few takes to get one that worked. And I had friends chiming in that said, oh, you know, my 13-year-old is going through something like this. My sister is having a hard time and she's in her 30s. I'm having a hard time. And it started this whole like organic discussion where it took off. And that's why I'm so excited to be here. And I've been that person who's talking about endometriosis in the grocery store line. Well, when we could go to the grocery store, talking about it everywhere. And if we start being comfortable with talking about pain, if we start being comfortable talking about blood, if we start being comfortable talking about not just cramps, but what they feel like, and really listening to girls, it's going to make all the difference.
Oh, absolutely. That you two have articulated this condition so well. I couldn't even come close to articulating as well as you have, even though I have seen thousands of people just like you with amazing stories of challenge, of climbing Mount Everest, just like you two have. And both of you are extremely courageous. And thank you very much for that introduction. And so, thank you all for sharing your background and journey with endometriosis. I see we have a lot of questions out there coming in. Let's take a few in the remaining time we have this evening. From Anonymous. What if you are on a blood thinner? Surgery is the last resort for many. Is a lab still the best option? Well, I'll go ahead and answer that since it's very medically oriented. Even if you're on a blood thinner, if you're suffering from endometriosis, if this is there's a high degree of suspicion, all right? Because if you're on a blood thinner, right away it tells me that you're not going to be a candidate for hormonal therapies, for example, because they're going to increase your risk of a deep venous thrombosis or some kind of thromboembolic event. Therefore, that blood thinner simply needs to be managed perioperatively in an appropriate manner. And then laparoscopic excisional therapy is still actually the best option to treat endometriosis, for that matter, diagnose it even. Because the only way you can truly diagnose it is with laparoscopy. However, for someone who works with endometriosis patients extensively, they have a 95% degree of certainty before they ever get into the OR. But thank you for that question, even if you're on a blood thinner. Good luck with that. So from Kylie, what do you do if your doctor brushes it off as just heavy cramps? Sad thing is he's done my prior 7 surgeries for the same condition. Yowza, Kylie, thank you for that question. I'll ask our panel to give their opinion of that. So what if he brushes it off? I mean, the doctor has done 7 surgeries, and now they're just saying, well, it's just cramps.
Well, that is that you have to make sure that the doctor that you're visiting listens to you and diagnoses you properly. Because you, inside your mind, you know what is normal and what is not. So you have to make a decision, you have to be courageous and speak out for yourself. Because nobody from outside can understand the amount of pain you're in and the amount of blood loss that's happening, and that how much it can affect your body. Because I remember going to the ER with an enormous amount of blood loss in a period, and when they checked my hemoglobin, it was 5.
Oh my goodness.
Yes, and the nurse there asked me, did you have a childbirth?
Oh my goodness.
And I said, no, I just had a period.
Oh my goodness.
And they had to give me 2 bottles of blood. like I was in the emergency for 2 days, and then they released me after 2 days when I was a little more stable. I was having shortness of breath, and I just passed out.
My goodness.
In my
That's
periods. So
what a story.
it can affect you in different kind of ways. Well, as a professional microbiologist, I had to stand for a long time in my laboratory, and during my periods, I can tell you, I could feel that I was like, the whole world is spinning.
Sure.
And especially I told my bosses to arrange a chair or a stool for me to sit, because I was not able to stand for 6 hours, 7 hours, which was required at that point of time.
My goodness.
So you know what is normal for your body.
I always, we always here at the Kaldas Center say to our patients, listen to your body,
Yes.
and we will listen to you. So, well, I bet we have a lot more questions. Shall we give you the next one, Andrea?
Sure.
Okay. From Abby, what did you do to manage your pain? How did you deal with that for over 2 decades?
It was really difficult to deal with that level of pain, and I sought everything I could find. I sought regular chiropractic care, physical therapy, acupuncture. All 3 of those help tremendously. Talking to your doctors about medication, and finding somebody who will listen and understand and not treat you like you're hamming it up to try to get a prescription. I think it really takes, finding the right doctor, finding people who believe you, and not taking no for an answer. But I think in addition to not taking no for an answer from a doctor is really pursuing things heavily with your insurance company. I made it my part-time job and learned everything I could about that industry, and was on the phone on a regular basis getting approvals and making sure that I could keep going to the doctor and I could keep pursuing care.
Isn't that amazing? And you're a lawyer.
Yeah.
And you found this insurance company stuff challenging nonetheless. It's really a challenge, and we encounter it frequently, and it is unfortunate because, insurance companies have contracts with certain groups or certain medical companies or certain doctors, and they want to believe that everybody is interchangeable. But we know as human beings that people and professionals are not interchangeable. And to get an insurance company to understand that and to let you see the right person can be daunting. But thank you for persevering. And so, from Jolie, have any members of the panel experienced infertility due to endometriosis? If so, how did you cope and keep hope? Thank you, Jolie. Shall we hand that one to you, Andrea?
Yes, infertility was the tip-off, the tipping point that made me decide that I needed to take one more trip to the doctor. And after the procedure, which if I maybe had gotten a doctor to listen before, it wouldn't have been so advanced. But by the time I met you, it was stage 4 endometriosis, and we discovered that my tubes are blocked. Which was something that I didn't expect. I think I've shared with you that both of my grandmothers had children into their 40s, and I know that doesn't necessarily indicate how fertile you're going to be, but I thought with generations of women before me having children so easily that it was going to come easily for me. It's really difficult, and I think pursuing talk therapy, taking care of yourself, continuing to care for your health, and remembering that you're a person too, you're a woman too, even if you may not bring a child into the world, that you're still a woman, that there are lots of ways to mother people, that you may not be a mom, but maybe you'll be a stepmom, maybe you'll be an adopted mom, Maybe you'll be the very best friend to your friends, and you'll always make sure that they're doing okay and they're healthy, that you'll mother the people around you. We're still pursuing options and seeing what lies ahead for our parenting story. But I think just remembering that your body can be an important vessel, but that to honor your body and not to be mad at your body or mad at yourself.
Absolutely. That was so well put. And I must say, because people in general don't understand the grieving of fertility issues. And obviously a lot of that has to do with endometriosis and because when, let's say you lose a loved one, well, everyone can relate to that. You have memories of that person. We have rituals, we go to funerals, we remember that person, and that helps us through it. Our friends help it through it. With the grieving of fertility and of endometriosis that is not acknowledged, it's a different kind of grieving, where you're in isolation, you feel, and you're somehow broken, and it's just miserable. And so it's very important to open up, to find that right professional.
I think that people are becoming a lot wiser and understand miscarriages. But when you talk about a failed IVF experience, or when you talk about an experience that never came to be, growing up, when you dream of becoming a mother, it really is like somebody in your family has died. But explaining that to other people, that you're mourning somebody who never lived and never existed, is very hard for people to wrap their brain around.
Well put. From Esperanza, what is the best way to be medically diagnosed with endometriosis? I've only had a physical exam and wanted an MRI, but was told it was pointless. Esperanza, in my experience, the best way to suspect and diagnose endometriosis is to have someone who really understands the disease, take a clinical history and listen, and then do an exam and know what they're feeling for. And that's all it takes to either highly suspect it or suspect something else. Because if you're having symptoms, believe you me, there is a reason. It just needs to be found, whether it's endometriosis or something else that's causing the pain. So then, to confirm the diagnosis and then treat it, minimally invasive surgery, laparoscopy, what I like to call the Kaldas Center, what Dr. Wong and I do, is precision surgery. Precision surgery. Sometimes it's millimeter by millimeter. This disease, causes a lot of inflammation and scarring involving nerves, very close and on sensitive structures like the bowel, like the ureters, like the major vessels in the pelvis, and so on, the diaphragm, and it's precision surgery. Not too much, not too little, it's that type of thing. And so that's why I think there are few and far between who can treat it and appropriately and diagnose it appropriately. So, all right. Oh my goodness, we're out of time already. That went by too fast because we had very special guests. Thank you everyone who joined the conversation. If we did not get to your question, we'll follow up with you in the next few days. And a quick reminder that if you'd like to speak further with us at the Kaldas Center, visit kaldascenter.com or give our office a call at 920-886-2299. Thank you, ladies. It has been an honor to be your doctor. Thank you for agreeing to come and share your stories.
Thank you.
And as for today, thank you, Sonali and Andrea, and again, you for spending your evening with us. Best wishes. Stay safe.